Okay, this is going to be a video for POS case 1010. We're going to do the lateral ceph tracing. To start this, I'm going to be already open to IPsoft 4.0 for this patient. I have here POS 1010 records, but you'll probably have it as a patient name from the previous seminar. I'm going to click the icon underneath the help, and this is to open up the dental CAD program. This is where you will process your x-rays and model measuring. Okay, so we're going to start out by importing an image, and if I was going to use acquire image, that would be for a scanner. So if I had a scanner hooked up directly to this and I was scanning the x-ray, then I would use acquire image. Import image would be an x-ray that's already been scanned or maybe is saved in another database in a digital ceph. So import image, we're going to use our CD or memory stick, whatever they gave you. So on my CD, I had like Seminar 1 student CD, and then when I looked in there, I had the records for the 10 cases. We're looking for case 1010 in a file folder. Start ceph is the one that I'm looking for. It's a TIFF file. We do have like a frontal ceph also here, but we want the start ceph, which is the lateral ceph. I'll click on that. It opens the file. Okay, now if we look, we have one interesting thing that we don't always have on an x-ray, and that is a calibration ruler, which we will use to determine if your machine is in calibration. There are some digital x-ray machines, particularly that are not in calibration, and they might be as far off as 20%. Usually the face is too small, but this one looks to be a fairly normal size face. But we're going to go ahead later and we're going to use that, so I want to leave that feature. Another feature here is the cervical vertebra, which we use for growth. I don't think this patient is particularly important for growth, but nonetheless, let's not chop off and any cropping the C2, 3, and 4, because that might be used sometime for growth, and we don't want to lose that. Well, we wouldn't lose it anyway. All right, but this ceph has been fairly well scanned. It doesn't have too much extra stuff, but let's do some cropping anyway, just so you know how to crop. We'll start with the filter rotate button, just down on the lower left here. I click that. And I can probably crop off a little here. Now always use the corner. Don't use any of these little side things there, just as a habit, because that always will change it proportionately. Okay? It's probably not that important here on this app, but just make a habit of not doing that. So I'm just going to move them in a little bit here. As I said, I'd like to leave that, and I'd like to leave this. Normally I would crop it all the way down to here probably, but here I am using the middle one for you. But, you know, down in Nasion, but I would like to use this little ruler just as an exercise for you. Then I click crop. Okay? Now, can I see this x-ray really well? Can I see all the structures? Oh, I can see everything here. This is a little bit washed out. This looks good. A point, I don't know if that can be a little better or not. That's usually somewhat difficult to see. And of course the mandible is fairly easy to see. Soft tissue is good here. So let's play with the filters a little bit. We're going to go filter, and then I'm going to click invert. Now that changes it quite a bit. And I think I can see A point quite a bit better when I do that. Now I could use equalize as well, but that kind of on this particular one, I think I lost a little bit of A point there, although some of the other structures look more clear. Okay, so let's return to the original image here. It says return to last crop. Just do the invert, and okay. Yeah, I can see A point, kind of, you can see this curvature in there. Okay. But it's now a little dark, you see. It took the light parts, made them dark, and now our little external auditory meatus is there, but it's not real distinct. Okay, so let's just try this X-ray. We can always change the filters during the time. So I'll start out working here with the dental analysis type. Here it's going to be cephometric analysis, and that'll be for her lateral ceph. And then I'm going to select the first point, which is nasion. Okay, now this little dot is following my cursor. And I'm going to go put it right next to the nasal bone and the frontal bone, right at the intersection there. And then when I click, when I let it up, I drag it holding the left click down, and then when I lift up on the left finger, then it positions it. And then I'm going to click F2 key, that's our hotkey, and I'm going to position cella. Now let's say that you can see this turned green on nasion and cell is still blue, so let's say I decide I didn't like where I positioned that. Well, it's no harm done, you can just move it. And then the next time I hit F2, it'll skip to the next point. It'll skip the already positioned point cella to porion the superior point on external auditory meatus. Okay. F2, orbitale, you can kind of see the eyeball here. Actually, it might be down here. And posterior nasal spine, anterior nasal spine, you can see that on this. And A point. Now, let's say I was having a hard time with A point. I can zoom in, and using the zoom feature, and I could see it a little closer. And you can see that the dot is blue with a little white circle in it. The white circle is the point, not the outside of the dot. Not so important here on the lateral ceph, but it could be very important when we get to the model measuring. Okay, I think I'm satisfied now. You can leave it on, the zoom feature, if you want to position some of these points. That was B point. This is pagonion, the most forward point of the mandibular symphysis. Nanthion, downward and forward, and menton, the most inferior point. Gonion, I like to position on the lower border of the mandible, although if you wanted to do the true gonion, it would be on the middle of the curvature here, which is hard to get consistency with the curves. Okay, I'm going to zoom out because I need a little bit more like perspective here. All right, next point is articulaire, and that's right where these two bones intersect here. I can't see the condyle very well, but it's not so important on some of these cases. I could change the filter, but that just takes time going back and forth. Tip of the nose, subnasal, that's where the nose and the upper lip intersect. Stomion, that's the lower border of the upper lip, and put the point next to the upper incisor. Soft tissue pagonion, most forward point on the soft tissue, of course, on the chin, tip of the lower lip, tip of the upper lip, and now we get to the teeth. Okay, now there is one incisor here, and then there's another one down here. I suspect that might be the lateral incisor that's blocked out. So I'm going to put the incisal edge there, and then I click on the tooth, and I can then rotate it until I have the long axis of the tooth. F2 gives me the next point. Okay, incisal edge, rotate till you have the tooth. Next point is the upper molar. Now, of course, the molar is not going to fit, so where do you put it? In the middle, the back. You do the mesial of the molar and the occlusal plane. And then you position it to the mesial of the molar. You can see there's some molar sticking out the back because the molar is never going to be exactly the same size as our template. F2 gives me the next molar. Not so important on the molars, except for the occlusal plane. And of course, later on, if you want to overlay it and see if the molar moves at all. Okay, so there's my 4 teeth. Next time I click F2, I'm going to get the lingual symphysis here. And it starts at menton. Menton 1, posterior symphysis, and the superior symphysis. Okay. Now, in between the square dots, or points, you're going to see these little tiny squares, and you'll move and let distort the line to fit your curve. Now, I started the mandible, and it's a series of points. And it's basically in between a couple of curves here. Okay, and so wherever the mandible starts to curve again, well, that's where the points would be. There's nothing really measured off of any of these. So it's not so important. I wouldn't stress over it very much, but you just want to make it look nice. And it might be nice sometime for an overlay. That's when you're trying to see where everything moved. Okay, and if you're not satisfied, you click on it again, and you move some points. It's okay. And if you don't like it at all, well, you could just hit the delete key. Ooh, okay. Now we usually try to avoid the delete key. Now, for me to restart it, I have to go over to the list of points and contours and select mandible. Do not, I will emphasize, do not change from point to point selecting from the list. Some of you will try to do that. You're going to miss points. It's going to mess everything up. So don't do this unless you delete something. Okay? Always use the F2 key to get you to the next point. Okay, so what's happening here? I go place the current object. Okay. Well, let's start back as symphysis. Let's see what happens here. Oh, okay, now I've got the start of the mandible. B point. Huh. Wonder what's going on there. Okay. Again, don't use that like delete key. Just forget it's even there when you're tracing. Let's see what happens here. I'll go ahead and position. Yeah, I'm very inexperienced at using that delete key. I don't know why I did it in this video. Okay. Alright, now what I'm curious is when I hit it again, what's going to happen? Okay, hit it mandible, and now I'm on to the lower. When I click F2 a second time, it moved over to the lower profile. So it started at stomion, went tip to the lower lip. The third point on this lower profile over the chin is called the sublabial point. And notice that I placed it at approximately the height of the apex, this little sublabial point. That is very important because it in the dental VTO, your lip will rotate around that point as your incisor goes forward or back in your predictions. The same thing on the upper. I just pressed F2. I start with glabella, down the tip of the nose, subnasal. I'm looking for upper labial sulcus. Now, a lot of you are thinking it's the curvature. It's not. Just put it up there on the lip, about the same height as the apex of a tooth, if you can. And that's good enough, because it has to do with rotation. It's not necessarily the anatomic structure. And it ends at stomion. So I hope you are getting the idea here of how this goes. I'm moving a little faster. Okay, F2 will get me the maxilla. That's the last structure. And I start forward of the incisor. And after A and S, I have three little points. It's kind of like a triangle up there for the vomer bone. Posternasal spine. Hard palate is right here, where it goes from horizontal to vertical and then down to the tooth. And then I just bend the line to fit my structure. And keep in mind, nothing is measured off of these structures, so they don't have to be perfectly exact. If you don't like something, you can always click on it again and move it around until you're happy. Okay. And then, if I click F2, nothing happens because I'm at the end of the line. Calculate and save. Okay, so it's going to ask you to label it, and you only have a choice of these. You cannot custom label it. You just choose this. Of course, this one's going to be start. Okay, and there we are finished with our ceph. And it will calculate all the numbers for us. And of course, you're not going to be within 1/100th of a millimeter from your neighbor, so I wouldn't stress over that. Oh yeah, let's go look at this calibration. And I can see the lines here. And it looks like I have maybe 15 millimeters or so that I can work with, maybe a couple more, but let's just go for 15 millimeters. That seems simple enough. Now what I'd like to do is get something that is measured. Now there's a couple here that are measured. One's the maxillary length, another one's the mandibular length. Those are both convenient. Why don't we use the maxillary length? I'm going to turn off the nomenclature. Well, that's not that important. Turn off the vectors. That's the little red lines. They're off. Clean it up. Turn off the drawing, and I don't see any points. Okay, so I turn the points on and off. That's just something about this program. And here's a point which I carefully moved. Well, let's see. Maybe I should leave that one alone. Maybe I should take B point. B point looks good enough. Looks like that's a little easier to place back in the same place. So I'll put B point up here on one of these lines. Remember, it's the white dot. And I'll take that condylion, and I'll move that on the line, approximately. It doesn't have to be exact. And then we're going to click calculate. And this should be 5, 10, 15 millimeters approximately on mandibular length. That's the one. Oh, we didn't do that. Oh, I see. Oh, that didn't like that. Mandibular length. Oh, I got B point and I have condylion. Oh, no wonder. Mandibular length is not B point. Duh. Okay, we'll leave like condylion up here. Mandibular length is from condylion to nathion, so let's take nathion here. That's the downward and forward point. That'll work a little better in our calculation. You see, I'm not perfect. And now we're at 16.41 millimeters. If I wanted, I could zoom in here and probably get a little closer. within the range of what we're doing. Let's see where we are here. Now we're at 16.6. Okay, so 15 and 16, that's pretty close. As I said before, you'll get off maybe 20%. That's going to be bad. This is within normal range in measuring that sort of thing. Okay, so I'll put Natheon back. I guess I'll put it back. Oh, now I really did it. I got it stuck over there. Now, you see, isn't this good? You can see all these little errors that I make. Oh, I'm not sure I can get that back. Candelion, I can get that back. Well, since I don't do this very often on the, I can't get that. I threw it off too far. I threw it over here. Well, okay, no big deal. Why don't I just throw this away? We're going to open it. Let's see if, yep, it's way over there. I still can't get it. I will use the red X. I'll throw it away and I will do it again for you. If you get all messed up, sometimes it's better just throw it away. So, 1010 start ceph. I don't think I have to crop it. That was just for your edification and knowledge. So, but I think I would like to maybe do a little bit of filtering here. I think I like that. Okay, so I select my first point. And I'll go at normal pace here for me. If you know the next point in the sequence, you can go quite quickly. Tip of the nose, F2, subnasal, F2, stomion, F2, soft tissue begonion, tip of the lower lip, tip of the upper lip, incisor, incisal edge, click on it again. Okay, next point, next tooth rather, incisal edge. Click one time, click a second time to be able to rotate it. It's kind of a tricky first molar there. Okay, mandibular symphysis. So I say once you understand how these points go, I'm no faster at clicking than you are. It's just I know which ones come next. And so shouldn't take you but maybe a minute or so to a couple minutes to do a tracing. Actually, I'll show you something here on this. This will be interesting. Once we get done, I'll show you how to edit when somebody else does your tracing for you, like a staff member. Because the doctor has to know how to edit somebody else's work. Because you will not always be doing this. Okay. Okay, calculate, save, start. Okay, so we're back to where we were before I started messing around with calibration. Okay, and of course the numbers are all here. They're probably a little different than the first one I did. Okay, let's talk about editing. let's say that somebody else did this x-ray and you wanted to make sure it was done properly. Okay, so the doctor opens up the file, turns off the vectors. The first thing I do is I click on the upper profile, and I'm looking for the third point, and that's at the level of the apex. That's a common error. I may have to move it. And then I click on the lower profile, and I'm looking for the third point. Okay, then I turn off the drawing, and I turn back on the points. And then I go look at all the points, make sure the points are in the right place. If not, then I can move one. Right? If I don't like it, and it tells me, well, what point it is, I can move it if I want. Okay, once I'm happy, I calculate and save again, and everything's there but the drawing, so I have to turn on the drawing. That's just in the program. Okay, so that's how to edit it. You first look at the lips, at the sublabial points, then you turn off the drawing, turn back on the points to edit the points, and then you're through with that. Okay, have we covered just about everything? Yes, I think the saving, magnification, cropping, filtering, the sublabial points, editing, and even the calibration for those of you that have a digital ceph. If you do not have a digital ceph, then you don't have to do that. Okay, well, I hope that you enjoyed this presentation, and oh, one more thing I should do. One more thing I just remembered. Let's talk about this cervical vertebra. Sometimes we would like to capture a view of the cervical vertebra, and what we're going to do here is we're going to use a screenshot program. Okay, now I've got this little icon here that is for Screen Hunter 4.0 Plus. It's a free program, never paid for it, I think. And it'll ask me, here you set your hotkey. You only have to do that once. I've set it to print screen. So when I click, when I touch the print screen, then it will start the program. And then it'll ask you, where do you want it to go to? And this is where you set your file folder. And so you tell it where you want it to go. So I'll say Seminar 1, Generation 6, I don't know. I don't know. You aren't going to have these. So I'll just send it to frontal skull, okay? And then you say standby. Get out of the way, volume. All right, well, I got a little messed up here, so I'm going to close the X-ray. That's with the little small red X. If I use the big X, the big red X, is to close the whole program. And then I open it again. And I got it all cleaned up. Okay, now I'm going to turn off the vectors, turn off the drawing. Now, except for the volume thing in there, I can see C2, 3, and 4. Okay, that's what I want. I want that. I don't want all the lines and vectors in there. So I'm going to hit the print screen button. That's my hotkey, and it starts the program. Now, I move it around without putting my finger on the left mouse key. And when I have it where I want it, I press it down and I drag, holding down the left click key, I drag a box around what I want the picture of. It's basically just a picture. And then when I lift up the left click there, it'll make a picture, and it's over in the file folder that I asked it to go send it to. The frontal skull. Let's see up there. Okay, so that's a screenshot, and I'll go ahead and show you what to do with that while we're here on the video. I'm going to go to my desktop, and on my desktop I have waiting for me the cervical vertebra growth assessment. So I'm going to click on that. That opens up Microsoft Word. And this is a document that you have in your CD. And the previous patient that I did was 12 years old. I don't think it was 03. Okay, so let's make this is 1209 is what the date that I'm doing. And this isn't a 12-year-old male, but let's just say it was. And then it'll have the growth stage 1 through 5 there. And of course ours is going to be 5 because I think we have an adult patient. Okay, now this is the standard. And then I have a little arrow here that I just leave and I move around. And then I'm going to take the old one and hit the delete key, and it's gone. And with the screensaver, all that I have to do is click paste, or right click and paste, or the paste icon up above. And where the cursor is like positioned, I'm going to get the screenshot that I just took. Now, isn't that clever? Okay, I highlight it, expand it out, and then I compare it to this. And of course you can see there's 3 curves on the bottom, and these are tall. So I'm down here at CVM 5. And then below this you have a growth curve, and then you just move. See, was this a girl? I can't remember. Anyway, you just move the arrow. Okay, and now you have a Word document that you could print, or you can screenshot this and move it into the patient file. Actually, I'll go ahead and, no, we don't want to do that right now. Now, I have to download a treatment plan. Well, why not? Treatment options. I haven't selected anything. Let's just do that. I click on that, and let's select non-extraction standard wire progression. Okay, and that drops it into this area. I click finish. After I have my list, actually I'll make it at least 2. You should always have at least 2. I considered this and I considered that. So let's do a bicuspid extraction. And I don't know if it's skeletal open or not. I can't remember. Probably average or so. Okay. And then I'm gonna click on that link. It takes me to the internet. You have to have the internet to do this. And I click to select the treatment plan, and it drops it into the patient file. Okay, and then you mark the treatment option in red. Now I don't know this case right now, so I'm probably doing it all wrong. It's in the wrong treatment plan. Now what I like to do is I like to get rid of all this fine print. Now maybe you don't right now. Maybe you want to read all that, but eventually you don't really need it. So I highlight it, I click the delete key, and now I have my treatment plan in blue. That's the summary treatment plan. And since I just clicked, no, I didn't just click. Where am I here? Cervical vertebra. Okay. So I'm going to do this in 3 steps. I click my print screen. I'll do the growth assessment. And go back to the patient file. I position my cursor here. And then I click paste. Okay. And then I go back to this. And this is how I put it into the patient's file. You would do this on all mixed dentition cases. You have a mixed dentition case coming, or any growing case that you might, 12, 13 years old, even if it's not mixed dentition. You might also do this. Put the growth data in there. It looks good, and it is good. You have considered more than other people. So So put the cursor, click paste, and I've got one more to do, and that's the growth curve. So print screen, outline what you want, and you take your picture. Those were just like windows that pop up that you have to close. And here we go. There's the cursor, enter, and there it is. Okay, so now I have my growth right along, right in the patient's file. Save. Boy, did we do a lot of things on this one. That started out being just a lateral ceph, but we did screenshots, cervical vertebra, treatment plans, move it in, calibration. I hope you enjoyed it. It was fun. I had a great time. Talk to you later.